Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. In the treatment of the gastric ulcers or peptic ulcers, we have drainage procedures are present for the peptic ulcers or gastric ulcers. One, we have Heinz Micculus pyloroplasty. This Heinz Micculus pyloroplasty is the most commonly performed drainage procedure. Then we have some other types, like we have Finney's pyloroplasty. This Finney's pyloroplasty is actually performed in a patient with J-shaped stomach, or if the patient has extensive scarring and narrowing. If the patient has either J-shaped stomach, or if the patient has extensive scarring and narrowing of the duodenal bulb, then we do this Finney's pyloroplasty is done. Then we can also have one more type of gastroduodenostomy, which is called as Jobolis gastroduodenostomy. This Jobolis gastroduodenostomy, mainly it involves the anastomosis of the distal end of the stomach with first and second parts of the duodenum. Here we will anastomose the distal end of the stomach with first and second part of duodenum. So actually this Jobolis gastroduodenostomy is done whenever there is severely scarred or deformed pylorus, or if there is deformed duodenal bulb. Like for example, if this is the stomach and here this pylorus is completely deformed, in such cases you will remove this and you will anastomose the stomach to the first and second part of duodenum like this. So this becomes Jobolis gastroduodenostomy. So these three are the drainage procedures which are associated with gastric ulcer.
thank you and thank you for watching.